Bismillahirrahmanirrahim. This is Abdurrahman and you are watching Animals Production Practices. In today's lecture we are going to talk on the different burns from which a person or the animal may suffer in the society or the environment, or the harsh environments may cause the burning at the surfaces of the body. The burn may be of different types: thermal or electrical burn. We will discuss in detail all types of burns, similarly their treatments, different antibiotics involved in the treatment, and different homeopathic treatment of this burn, and similarly we will discuss the management of the burning site. So let's start. Functions. If we talk about the function of the skin, skin is the largest organ of the body. It is essential. The skin is essential for the thermoregulation. Thermoregulation means the maintenance of the body temperature. Skin is essential for the maintenance of the body temperature. Next function is prevention of fluid loss by evaporation. It is also controlling the evaporation of the fluids present in our body just by sweating. Otherwise, the fluids present in our body may evaporate without skin extensively. Next function of the skin is barrier against infection. Imagine if would be no skin at your body, then what would be happen? Then what could happen? Just imagine your body organs will be exposed to the environment. Exposed to the environment mean the exposure to the pathogen, the allergens, the germs, and eventually they will attack on your body, open surfaces, and will cause infection. So body is a major barrier against the infection. Protection against environment provided by sensory information. These are the functions of the skin, which the skin is providing to us and to the animals as well. You can see in this picture the cross section of the skin is demonstrated over here. In this pic you can see the at the upper side of this cross section is hair shaft and the pores from which this sweat come out of the body, and the hair shaft, the hairs we see on the body. And then the layers of the skin start: epidermis, dermis, subcutaneous layer, then fat, then eventually come the muscle. If we talk about the types of the burns, there are different types of the burns which a person or the animal may suffer. The burn may be of thermal or a chemical or the electrical or the radiation type. Let's start the thermal. Exposure to flame or a hot object. It's very common in the houses, like the most of the females oftenly suffer to hot object, touching the hot object, or exposure to flame, and just so causing the thermal burn over their body. Next is chemical exposure burn. Exposure to acid, alkali, or organic substances. The chemical exposure, if we talk about the example of this chemical exposure, chemical burn, we may consider the sulfuric acid, which we in common name in the local language we called as it tezab. The chemical may cause the burning of the upper surface of the body, and if its concentration is high, If the concentration of the chemical is high, it may cause the burning of the inner layers, inner surfaces of the skin as well. The next type of burn is electrical. It results from the conversion of electrical energy into heat. Extent of injury depends on the type of current, the pathway of flow, local tissue resistance, and the duration of the contact. Most of you all may have exposure or seen the current or the electrical burn procedure or the exposure live. What happen in that exposure is, if a person is going in touch with the electrical appliances, and, if that appliances or that object or the electrical wire is giving the current or the short, it may cause the electrical burning to the person. Radiation result from the radiant energy being transferred to the body, resulting in production of cellular toxins. Radiant energy being transferred to the body, resulting in production of cellular toxins. We may call it as a bioburn, as cellular toxins are the subjects are producing in this type of burning. Burn wound assessment, classified according to the depth of energy and extent of body surface area involved. If we want to assess the burning, how much the body has burned, then first of all we would have to know the depth of the injury and the extent of body surface which is burnt. Okay, then burn wounds differentiated depending on the level of dermis and subcutaneous tissue involved. Like if it is damaging only the superficial, then we may call it as first degree burn. If it is causing the superficial plus the deep surface of the body, then we may call it as second degree of burn. And next come is, if the burning is happening to the superficial, deep surface, or the full thickness, or the up to the muscle, then we may call it as third or fourth degree of burn, which is very dangerous. You can see in this the picture: first degree burn, second degree burn, and third degree burn. First of all, look at the layers of the skin: epidermis, dermis, and subcutaneous. Whom we may call as first degree burn if it is only causing the epidermis layer or some type of dermis, only touching the dermis but not damaging the dermis. We may call it as first degree burn or superficial second degree. But if it is burning is causing or damaging the dermis layer or approaching to the dermis layer, then we should call it as second degree burning. And if the burning is damaging the both epidermis, dermis, and reaching or approaching to the subcutaneous fat or up to the muscles, we may call it as third degree or fourth degree burn. Superficial burns, first degree. Epidermal tissue only affected. In first degree burn, only the epidermis is affected. Erythema, blanching, or pressure or mild swelling may occur. No vesicles or blisters initially are found. No serious unless large areas involved. The sunburn, we may call it as first degree burn. First degree burn is not more dangerous but type of burn. It is very common. Next is second degree burn. It involves the epidermis and deep layer of dermis. Fluid-filled vesicles may form. The skin may go to red, and the shiny, wet, severe pain occur. Hospitalization required if over 25% of the body surface involved, that is tar burn or the flame. How the second degree burn may cause? By the tar burn or flame. Tar mean in the local language, in the Punjabi we called it as lok. Next is full thickness or the third or fourth degree burn. Destruction of all skin layers. It requires immediate hospitalization. Destruction of all skin layers means has damaged all the epidermis, dermis and subcutaneous as well. So it requires the hospitalization immediately after the burning. Dry, waxy white, leathery or hard skin, no pain. Pain may not occur, but the skin has damage at all. This type of burning may cause, due to the exposure to flames, electricity or chemical, can cause third degree burn. Calculation of the burned body surface area. If we want to calculate the body, how much the burning has damaged the body, we can calculate by the following methods. First of all, total body surface area we have to calculate first. Superficial burns are not involved in the calculations. Okay, superficial burn are the first degree burns. We do not calculate such type of burning involved in this superficial burning. Land and Browder chart is the most accurate because it adjusts for age. Rules of nines we will discuss in the later slide. Rules of nines divides the body. Educate for initial assessment for adult burns. Rules of nines. Head and neck. We assign 9% or the 9 points to the head and neck region, and the upper extremities or the arms to 9%, and 18 points for the legs, 18 points for the anterior trunk, and the 18 points or the 18% for the posterior trunk, and for the genitalia of the animal we assign only 1%. So if a type of burning is damaging only the legs, only the legs of the animal, we may call it as 18% of the body has damaged or the burned. This was the example. Next is burn pathophysiology. Severe inflammatory reaction may occur, like the bleeding by the capillary leakage. So intravascular fluid may lose, or the loss of body fluid may occur. High fever may cause due to the disruption. And next is protein degradation. Protein degradation may occur as the body muscles are also going to damage under the burning. If the burn is due to fluid or any type of toxins or any type of chemical, it may cause toxin production in the body. Pathophysiology. Pathophysiology occurs initial vascularized vasoconstriction, then dilation. If we talk about the what happened in the burning, first the vasoconstriction occur, then the dilation. Blood vessels dilate and now the leak fluid into the interstitial space, known as third spacing or capillary leak syndrome. It causes decreased blood volume and blood pressure. Occurs within the first 12 hours after the burn and can continue up to 36 hours. This is the flowchart are the steps involved in the burning procedure. First of all, the vasoconstriction of the blood vessel occur, then the dilation, and in the dilation the capillary leakage will occur and the fluid will come into interstitial space, and so capillary leak syndrome may occur, which cause decreased blood volume and blood pressure. And this all process may occur within 12 hours after the burning and can continue up to the 36 hours after the burning. This is the formula of fluid resuscitation. Fluid resuscitation means to fluid resuscitation, if we talk about it, involves the 2 to 4 milliliter of linger lactate per kg of the body weight per percentage of the body surface area burned. LR we may call it linger lactate, linger or the linger lactate. We have to provide it in first 24 hours after the burning. If we talk about the Parkland formula, Parkland formula will work if the body has burned more than 25%. What is the formula? 4 multiplied by weight of the body in kgs multiplied by total body surface area, how much it has damaged, is equal to milliliter over 24 hours. Delivery half volume over first 8 hours and then second half in the next 16 hours we have to provide to the affected animal, on the affected animal. If we talk about the treatment of the burns, wound management or the topical antibiotics are involved, may be used. First of all, the first one antibiotic is mefenide acetate sulfamylone for cartilage, good at penetrating scar but is painful. It's a broad spectrum antibiotic. The side effect may occur as metabolic acidosis, while carbonic anhydrase inhibition may occur in the excessive use of the sulfamylone. Next antibiotic is bacitracin for face. If the burning is on the face of the body, then we may use the antibiotic as bacitracin. It's the gram-positive bacteria. The next antibiotic we may use in the burning is sulfadiazine. We may call this silvadine for trunk and extremities. It's also a broad spectrum antibiotic. It does not penetrate scar well. Avoid if sulfa allergy. If the body is suffering from sulfa allergy, then we should avoid the usage of this antibiotic. The side effect of this antibiotic is neutropenia may occur. Similarly, thrombocytopenia may occur. Treatment should begin immediately to cool the area of the burns. This will help alleviate pain. For deep partial thickness burns or full thickness burns, begin immediate plans to transport the victim to competent medical care. For any burn involving the face, hands, feet or completely around an extremity or deep burns, immediately medical care should be sought. Not all burns require immediate physician care should be done, but should be evaluated within 3 to 5 days after the burning. Remove any hot or burned clothing. In the summer season, especially, remove all the hot or burned type of clothing. Carenol may be used at the burning site. How can we prepare it? We only two things we require: calcium hydroxide and mustard oil. We will take one part of the calcium hydroxide and 1 part of mustard oil. We have to mix both of these parts, both of these ingredients vigorously and mix well and apply topically at the affected surface.